Today, we're jumping into something that's so important for so many caregivers, a really practical look at oral care for individuals with special healthcare needs. And it all really starts with this one question, because a healthy mouth isn't just about avoiding cavities, right? It's about overall health, it's about comfort, and it's about quality of life. So let's explore how we can make that a reality for absolutely everyone.
So, why do we keep talking about preventive care? Well, it's all about getting ahead of problems before they even have a chance to start. For someone who might find a big dental treatment really stressful or difficult, prevention isn't just a good idea, it's literally everything.
And the goals here, they're pretty straightforward, but so powerful. We're trying to prevent pain, keep people healthy, and steer clear of those complicated procedures. But what might be the most important goal of all? Empowering both the individual and their caregiver to build a positive routine that actually works for them. Here's the most important thing to keep in mind. There is no one-size-fits-all solution here. Not at all. Genuinely effective care always starts with taking a moment to compassionately assess an individual's unique situation and abilities. And just so we're all on the same page, this is the definition we're working with. It's a really broad term, which is helpful because it reminds us just how many different conditions can impact those day-to-day activities. And yep, that includes something as basic as brushing your teeth.
So, the best way to approach this assessment is to break it down into these 3 pillars. We're going to look at sensory capabilities, cognitive capacities, and functional performance. Let's dive into each one and see how we can tailor our approach.
Okay, first up, sensory capabilities. Communication is key, right? And if someone is dealing with vision or hearing impairments, we have to get creative and adopt how we connect with them.
Now, what I love about this is how practical these solutions are. For someone with a visual impairment, something as simple as an oversized model of teeth can make a world of difference. And for someone who is blind, we can just shift the entire focus to the feeling of a clean mouth. That becomes the new measure of success. How cool is that? And this is just a fantastic illustration of respectful communication. Facing the person, using demonstrations, and then, this is key, having them show you what they've learned on a model can be way more effective than just talking at them. Oh, and here's a great pro tip. Turn off hearing aids to avoid that awful high-pitched squeal from dental tools. All right, let's move on to our second pillar, supporting cognitive abilities. This is all about how we teach and reinforce those oral hygiene skills, remembering that everybody learns differently and at a different pace.
I absolutely love this quote because it's so simple and it just works. Don't just tell someone what to do. First, you tell them. Then you show them how, maybe on a model, and finally, you have them do it themselves. It's this powerful little sequence that engages multiple senses, hearing, seeing, doing, and that really helps the skill stick. So the big takeaway here is to make learning feel manageable and positive. Think short and sweet sessions, simple language, lots of repetition, and tons of immediate positive feedback. Breaking a huge task like brushing your teeth into tiny, achievable steps can make all the difference in the world.
This chart is such a great reminder that support isn't just an all-or-nothing thing. A caregiver's role might be anything from a simple verbal reminder to providing complete physical help. The key is figuring out where someone lands on this spectrum so you can give them just the right amount of support. And that leads us right into our final pillar, functional performance. This is all about the physical act of brushing and flossing, which, as you know, can be a real challenge for folks with limited motor skills. Here's a fantastic tip right from the source. Just asking, can you feed yourself? It's such a quick, simple way to get a sense of a person's range of motion. If they can do that, it gives you a really good starting point for what might be possible with a toothbrush. Okay, this is just brilliant. Who knew a bicycle grip could be a dental tool? It just goes to show you don't always need fancy, expensive equipment. Sometimes simple, creative hacks like these can make a regular toothbrush so much easier to hold and control. Ah, yes, the classic manual versus electric debate. And honestly, for many people with special needs, an electric toothbrush can be a total game changer, especially if dexterity is an issue. Yeah, the extra weight can sometimes be a factor, but for a lot of people, it just makes the whole process easier and way more effective. And hey, for those situations where you need a bit more support, it's good to know that this kind of specialized equipment is out there. Things like mouth props and headrests are designed specifically to make oral care safer and more comfortable for everyone involved.
Okay, so we've covered how to assess and how to adapt. Now let's pull it all together and build a preventative toolkit full of strategies for great long-term oral health. We can't talk about healthy teeth without talking about diet. The advice here is super direct and actionable. Try to limit snacking between meals, offer sweets with the meal and then brush right after, and maybe think about using things like toys or fun outings as rewards instead of sugary treats. Now, at-home care is absolutely crucial, but it works best when you team it up with professional therapies. Sealants are like a raincoat for teeth, and fluoride varnish is amazing because it can be put on super quickly and works even if the mouth isn't totally dry. And for some people, chemical plaque control might be a great option too.
And when you boil it all down, this is maybe the most important takeaway of all. Success is a team sport. It really takes a true partnership between the caregiver, the individual, and their dental team, all working together with clear communication and the same goals.
So, as we wrap this up, let's make it real. Looking back at all these different strategies we've talked about, from new ways to communicate to simple toothbrush hacks, what is just one new thing you can try this week to make oral care a little easier, a little more effective, or maybe just a little more positive? Thanks for joining me.